Okay.
Yes.
Yes, Ryan.
Thank you. We'll go ahead and get started. So I'd like to say good afternoon. My name is Ryan Tekak, and I represent Mahoning County Public Health as the Health Commissioner. I want to first thank our healthcare partners who have joined us today during this press conference, which includes Dr. Kravick from Mercy Health, Angela Kearns from Southwoods Health, Health Commissioner Aaron Bishop from Youngstown City Health District, EMA Director Dennis O'Hara, and Giant Eagle Pharmacies was unable to join us today. The focus of this press conference is to inform the community about the limited quantity of Phase 1B vaccines that will be received here in Mahoning County, and how the public identified in Phase 1B can pre-register to hold their space in line. We want to vaccinate everyone in our community, but we also ask for your patience as we continue to work through this process, as the vaccine is very scarce. We are pleased to announce, starting next week, Mahoning County will be receiving a very limited amount of vaccine. The total amount will be 3,075 doses. I stress the initial Phase 1B vaccine is very limited. And with the 3,075 doses that have been divided among the following partners, we will inform the public on how they can register to receive their vaccination at their designated clinic locations. On the screen currently, you will see the providers that will be receiving the doses for Mahoning Valley. Mahoning County Public Health will be receiving 400 doses. Youngstown City Health District will be receiving 500 doses. Mercy Health Boardman will be receiving 500. Mercy Health Youngstown, 975 doses. Southwoods Healthcare, 200 doses. Giant Eagle Pharmacies located in Boardman, Poland, Austintown, and Canfield will each be receiving 100 doses. My fellow healthcare colleagues that have joined me today will provide these options at each of their locations on how they can get registered. Currently, for Mahoning County Public Health, residents of Mahoning County who do not live in the city of Youngstown must pre-register by using two simple options. These options will be live starting tomorrow, Friday, at 9 a.m. Any walk-in registrations or vaccinations cannot be accepted. Again, this is due to the limited amount of vaccine and to ensure that we can properly plan and screen based off of the ODH guidelines for Phase 1B. Again, for Mahoning County Public Health, option 1, we have created a link that can be found on the Mahoning County Public Health website, which is www.mahoninghealth.org. Once again, that's www.mahoninghealth.org. The link provided will be for residents of Mahoning County that are in Phase 1B and 1B only to pre-register and hold a place in line. The link on the website will be a simple questionnaire that will log your information. It'll be your full name, your age, date of birth, gender, and a good contact information. This information will then transfer to an Excel spreadsheet that we will use to schedule appointments. Option number 2, which is available because we understand that not everybody has the option to be able to use the computer, we have set up a call center that will be staffed Monday through Friday from 8 a.m. to 4:30 p.m. We ask callers to only call during those designated time frames of 8 a.m. to 4:30 p.m. Individuals may call the number 330-270-2855 and follow the prompts, which will be option 9. Our call center staff will assist the caller by entering in the survey information as described in option 1, and then it will be transferred to the Excel spreadsheet as well. People who pre-register using either option 1 or option 2 will be contacted later to schedule an appointment, date, time, and location. Scheduling will be subject to the availability of the vaccine. Therefore, again, we ask for your patience during this process. and we only ask that you complete one of those options. Those are the two options for Mahoning County Public Health. As I've said, we're receiving 400 doses. Our intentions are to have this up and running first thing tomorrow at 9 a.m., and we will be scheduling for appointments with the limited availability of vaccine for next Thursday and Friday. Next up is Youngstown City Health Commissioner Erin Bishop, which will describe her process as well.
Good afternoon, everyone. Thank you, Ryan. It seems like it was just yesterday we were all getting together, this group of us, along with Mercy Health, to discuss what was happening when we were first finding out about COVID-19. So we're fast forwarding less than a year later, and here we are at the vaccination stage. I am here today to talk to you about our process for registering. We did start a little bit earlier than the county. We were just having so many phone calls, so we wanted to see if we could get people to register early. I will tell you that it is on our website. You could go to covid19.youngstownohio.gov. Again, covid19.youngstownohio.gov. You will be able to click that link on and directly give the very little information, name, first, last name, date of birth, phone number, the zip code, where you reside, and then you have a drop down to what age category you are in. I will tell you that as of this afternoon, we've had 2,324 people register on our website. Of that 2,324, 2,025 are over the age of 65. 70% do live within the city limits, and of that, 416 are over the age of 80. So we do have 500 doses as of right now. We figure more people will be registering, so we'll have the 500 and be able to get them out. We're going to start doing our clinic on Tuesday, and it'll go through Saturday. So we'll have all 500 of our 80 and over vaccinated that have pre-registered. I have also reached out and have spoken with Youngstown Metropolitan Housing Authority, and they do have 3 senior living in the city of Youngstown: Norton Manor, Amelia Plaza, and Gutnick Towers. And so they're working on getting me a number so that we may be able to go to those places and do the vaccine there. And then I'm also working with Park Vista Independent Living. They reached out to me as well. So we're trying to work, like I said, and going to the metropolitan housing places where they are and through the community. People ask, and I know we did have, like I said, we have 70% of people that are pre-registered that live in the city. For those 30%, and again, I mean, some people, it says right when you click on that, you need to be a Youngstown resident, but people do, make a mistake and they register, and so we're not going to not vaccinate you for those that have already went and did that. So we work with the county very well. We've been working with different agencies right now in 1A. There are a lot of people that we vaccinated that weren't specifically Youngstown residents, and so that's okay. And so anyone that has registered through our website, don't worry, you don't need to re-register somewhere else. We will take care of you. We will get you vaccinated, and we will start that on Tuesday at the Eugenia Atkinson Rec Center, which is at 903 Otis Street. It's about 2 blocks away from St. Elizabeth's main campus on Belmont, and it'll be on our website so you know how to get there. We will be calling you Friday, tomorrow, and Saturday to schedule those appointments. And again, they'll start on Tuesday and end on Saturday with all 500 of our 80-year-olds that have pre-register in 1B done. So if you have any questions, feel free, to contact me. Also, we do have an option for people that don't have the capability to use the computer. It's 330-502-4276, and that will take you right to the Youngstown City Health Department. That line is open from 8 to 4, Monday through Fridays. So, and again, we'll walk you through it if you need to, and we'll put you right in the computer. So we still, again, have availability for people to sign up for 80 and over right now, and that's what we'll be taking care of this week. So thank you. And I'm going to turn it over now to Southwoods, or Dr. Kravik. Sorry, Dr. Kravik.
Thank you, Erin. Thank you, Ryan. Mercy Health Youngstown has created 3 separate community vaccine locations for those in phase 1B for distribution for the vaccinations. In Mahoning County, Mercy Health North Lima Medical Center in North Lima and the Mercy Health Youngstown Primary Care location in Youngstown, right across from St. Elizabeth Youngstown Hospital, will be our community vaccination sites. We will also have 1 other community vaccination site in Trumbull County. These locations will vaccinate those defined as meeting the 1B criteria from the Ohio Department of Health. At this point, we are working through details and logistics as far as the Moderna and Pfizer. I know I get that question a lot, and this will be working through logistics between Pfizer and Moderna vaccine. It's important to note that these vaccinations are by appointment only. We will not be able to accept walk-ins. A dedicated Mercy Health scheduling hotline has been developed to schedule appointments. At the time of scheduling, patients will be asked a series of screening questions to ensure that the administration criteria is met. The number is 1-866-624-0366. Again, 1-866-624-0366. Also, mercy.com is our most update information on our website. And you can see the appointments, locations by appointment only on Market Street in North Lima and on Belmont Avenue in Youngstown. Both the initial and the second vaccine administrations will be scheduled during your registration process, during the phone call, both by either on the number or on the mercy.com and clicking the COVID-19 banner at the top of the page. We would ask that individuals please, if they have the availability, to print the attestation form that is located on mercy.com prior to their appointment. This helps speed up the process and makes it a smoother flow for your experience. But if unable to print, forms will be available when you arrive. We will require anyone receiving a vaccine to wear a mask when entering, visiting, and exiting our facility. And again, we're very happy to and proud to partner with our healthcare partners in Mahoning County, working with Youngstown Health District, Mahoning County Public Health, and we're just very excited that this time has come that we can move to the 1B phase of vaccinating our public. We get asked all the time, what is the end of this? When is the end game of this? And truly, I believe that the more patients and more residents of our community that we can vaccinate, the closer we will come to having a safer environment for all of us. So thank you for your time today.
Next, I'd like to introduce Angela Kearns from Southwoods Healthcare.
Good afternoon, everyone. We're thrilled to be a part of this public health initiative. We have long since been advocates for our community. I think we all have relatives that have been affected by COVID, and we're so happy to be able to spread some good news and good health to the community. So Southwoods Health was really thrilled to be a part of this and to get 200 doses, but with 200 doses, we have very limited appointments. So tomorrow morning at 8 a.m., we will have a hotline. The number you can call is 330-965-5099. You will get a recording to leave a message. We ask that you give your first and last name, your date of birth, and a phone number where you can be reached. If you get an appointment, you will receive a call within that day. Again, we have very limited supplies, so I think we will run out very quickly, but you will receive a call within the day that you have gotten an appointment. When we call you back and schedule your appointment, we will collect a brief health history, and then we will give you the information on where to go. This will be on the surgical hospital at Southwoods campus, but we will give you more specific directions on where to go and what time when we call you back. We are following, as everyone else is, the Ohio Phase 1 criteria to a T. We expect you all to social distance and wear a mask. I think that's been said before. And also, again, we cannot accept anyone who walks in. We will open that line tomorrow at 8 a.m. We will take calls Monday through Friday, 8 a.m. to 4 p.m. And then soon we will have a registration form on our webpage. Please keep checking there, because as we continue to roll out this vaccine to the other age groups, you will be able to register there. Thanks again for choosing Southwoods Health, and we're thrilled to be a part of the community.
As stated earlier, Giant Eagle Pharmacy was unable to attend, but they have asked for me to read this statement. Giant Eagle Pharmacy is eager to do our part to help vaccinate Ohio residents who fall within Phase 1B. We are actively working through the state's latest guidance and will be prepared to begin scheduling qualifying Ohio residents as early as next Wednesday, January 20th. Qualifying residents are encouraged to call their local Giant Eagle Pharmacy beginning next Wednesday to see if their pharmacy has received vaccine and if a vaccine appointment can be scheduled. I'd like to now turn it over to Dennis O'Hara, our EMA Director for Mahoning County.
Thank you, Commissioner. So on behalf of Mahoning County Emergency Management Agency, I am an extension of the Mahoning County Board of Commissioners, and I would like to thank everybody for assisting in this vaccine distribution. The Emergency Management Agency from the beginning has partnered and coordinated with all of our healthcare partners, including the Health Department, Mercy Health, throughout this process. And it has been a long process. It has been a long year. I would encourage everyone to have patience with this process as we move through it. We do have a limited amount of vaccine available at this time. More will be forthcoming, but as we move through this process, please be patient with us. The county will post all this information in addition to the Health Department and the city posting it on their websites, as well as our healthcare partners of Southwoods and Mercy Health and Giant Eagle. The county will push it, will post this on the county commissioner's website, social media. So we're going to push this out as much as we possibly can for the residents of Mahoning County to obtain the vaccine so we can move forward with this. Thank you.
We'll have some time for some questions. First, I want to thank our residents and businesses in Mahoning County who have been impacted by this pandemic over the past year. We sympathize with your hardships and what you have endured over the year, and we will continue to work hard in making sure this vaccine is distributed swiftly and safely to the public. I also want to thank the members here at Mahoning County Public Health, as well as our healthcare partners, for their countless hours and dedicated work that they have done over the past year and will continue to do to ensure that this vaccine is distributed. With that said, we can go ahead and open up for questions.
Ryan, this is David Skolnick from the Vindicator and Tribune Chronicle.
Hi, Dave.
Help me with my math, because I'm counting based on what you gave 2,000. I'm missing 100 doses. I got 400 for Mahoning County Public Health, 500 for the city, 500 for Mercy Health Boardman, 975 for Mercy Health Youngstown, 200 for Southwoods, and then 400 for Giant Eagle, 100 each in Boardman, Austintown, Poland, and Canfield. And I come up with 2975. Did I miss anything?
Did you get the Boardman Giant Eagles as well? There's two.
Yeah, Boardman, yes, 4 of them. Boardman,
So there's
Austintown,
1, 2,
Poland,
3.
Canfield.
So there's Poland, Boardman, Austintown, and Boardman. So it's the Giant Eagle at 478 Boardman Canfield Road.
Oh,
Giant
two
Eagle Farm,
Boardmans.
2 Boardmans, yes.
Okay, all right. Well, that would count. That would count up to it then.
Okay.
Okay. Are you guys? You're expecting more after this initial first week of them?
We're hopeful, yes. So currently we were notified at the beginning of this week of the doses that we were going to receive here in Mahoning County for Phase 1B. We continue to have contact with the Ohio Department of Health to be able to provide them with numbers that we would request. But the allocations truly come out of the Ohio Department of Health as it's distributed as we work through the phases.
Do you know about how many people 80 and over there are in Mahoning County?
I don't have that number off me right now, but I can get that for you.
Hi, Ryan. This is Jessica from Mahoning Matters. I was wondering, the governor has spoken a bit about a couple instances where there have been vaccines being wasted. I was wondering what your backup plans are for any vaccines that might not be used during clinics. I've heard in Washington State that folks are creating reserve lists where people agree to be available, at a moment's notice to come in if there happens to be extra vaccine. And I was wondering if you're considering anything like that, or generally what your backup plans are to ensure that nothing is wasted.
Okay. Yeah, I mean, I can speak on Mahoning County Public Health. So, I mean, as we've worked through phase 1A, and this is why we're making sure all the appointments are scheduled. So then we know how many doses that we have to use per vial. And if perhaps there's a chance that there's some doses that are left over, we do have a long list that was in phase 1A, healthcare partners that we would work down through and call them to ensure that we are wasting no vaccine. We will do the same with phase 1B. I can guarantee we will have a long list and we can make those phone calls towards the end of the day and ensure that those vaccines are distributed to someone in phase 1B.
Yeah, this is Jim Kravick from the Mercy standpoint. Just really, I think that is essential that we don't waste. And we had planned during 1A as well, where we vaccinated our healthcare workers and our medical staff members, and there was nothing was wasted. And we have the same plan with the backup lists and the like, so that we have the same outcome of not having any wasted doses. So I would agree. It's essential that we don't waste anything.
Great. And you mentioned that nothing has been wasted at Mercy. Brian, have there been any doses wasted at Mahoning County, or any issues like we've been hearing about in other places?
We have not here at Mahoning County Public Health. I don't know.
Thank you.
Hey, Ellen, this is Erin Bishop from Youngstown City. I did want to also get in on this to let you know that we do as well have a backup plan, and that we've had over the last couple weeks, a couple of days where we had a few left over, and we just called them, and if they could be there within an hour, we get them vaccinated. If not, if they say no, we just go on to the next person. So our list is probably 100 deep, and so we never have to worry about, getting rid of any of those vaccines. So again, when we need a list, we'll ask people, but right now we do have a solid, like I said, about 100 people on that waiting list.
Awesome. Do you plan to open that list up to the public at any point in time?
I think if we would go through it, absolutely. But right now, and again, it's like I said, we have 1B people ready. So for me this week, we had, 2 left over the other day. So I called 2 people that were on the list. One woman was 92 and her daughter was excited and she got her there. And so we just kind of make sure that we try to stay with, in that time frame, 1B, 1A, and getting them vaccinated.
Awesome. Thank you.
Mm-hmm.
Commissioner?
Yeah. Aaron?
Natalie Fowler here. Hello?
Did you want Aaron or Ryan?
Whoever can answer the question. So do people just pick their provider out of all the numbers and the websites you guys gave us for 80 and ups? Do they just pick one of those and call, or should they call multiple? How do they choose who to call first?
I mean, I think you can go ahead and pick whatever. Obviously, with the city of Youngstown, we focus on the city of Youngstown residents. But again, as I said before, people did register that were not Youngstown residents. So for right now, we would be able to take them. If not, people can just go about, where their location is. If they feel like, oh, I live close, I'm in Poland, I'd rather just come to the Giant Eagle in Poland, they could, try to go on and set up there. If they're booked, then they may move on to the Mahoning County District Board of Health. So I think it's really where, we try to be convenient at different places throughout the county to help people so they're not traveling a lot. But like I said, with an option of, how many 8 different places where hopefully someone can find a place. Again, there's not going to be enough for everybody in this first week, but we're hoping each week we'll get more and more as we continue, down the different phases from, 75 and over starting next week. And then we also throw in the schools, and also the ODH has a big plan that we have to follow every week. And I think it's been, it keeps us organized, and it's very important, especially when you have the 2 doses. So we have to keep everyone organized so we make sure that they're coming back for that second follow-up appointment to receive the second dose.
And how do you guys plan on making sure everyone gets that second dose and make sure that everyone's coming back? And also, when they call, it sounds like it's first come, first serve. So will you guys just go down the list as you go and continue with who called from the beginning?
Yes, so that's how we're doing it, because like I said, we've been having it for about a week now. So our first calls, and they go all in order, and we're just going to go down the list starting tomorrow and get them put in. But also, there was another question you had asked. I'm sorry. The second dose.
Yeah, the second dose, making sure, and I'm asking this for all of Mahoning too, not just Youngstown. So I don't know if Commissioner TCAC should answer that part too, but just making sure for both of you guys, it's first come, first serve, and you guys will go down the list from when people call from the beginning. Yeah.
I'll answer that other question, then I'll move it on to Ryan. But for our second doses, what we do, when they come, we give them a reminder card to come back. We have the date, the time that they're coming back, the location, and then the week before, we'll send them out a reminder text if they gave us their cell phone number. We'll also, if they don't have a cell phone, we'll call them the week before, so really just to enforce. And then again, when the nurse is doing their vaccination, they really stress to them that this is so important that they get that second dose. We haven't started our second doses yet. It won't happen until the end of this month. So we're hoping to have a good turnout. And again, we'll keep you, letting you know exactly how many people are coming back for that second dose and our percentage rate. So I'll turn it over to Ryan now.
Thank you.
So our process is the same. So when you get scheduled for your first appointment, we will also ensure that we schedule you for your second appointment. And you will also receive a vaccine card when you're vaccinated at the appointment that will be there to remind them of their next appointment.
Got it. And is there any cost for these vaccines, and what should they bring with them, make sure they have with them at their appointment?
So I can speak for Mahoning County Public Health. There's no cost for the vaccine, whether you have insurance or not. We're accepting anyone that signs up, and they just need to bring a good identification card.
Thank you.
Thank you.
This is Josh Medor from the Business Journal. So with that, sort of the staggered rollout that the ODH has laid out with, I think it's 80 and over this week, and then 75 moving in those kind of increments. Is with people scheduling these, I mean, is there any concern that the people who need it, who are in that maybe 65 plus category, who aren't scheduled to get it until February 8th, is there any concern that those people may be waiting for this vaccine?
Yeah, there is a potential, that we're going to have to wait. The state has asked for us to stress the scarcity of the vaccine. Like I said, we don't know how much we're going to receive or when we're going to receive it. But what I can ensure is when we do receive the vaccine for that week, we will make sure that we get it out within the time frame. Essentially, if we receive vaccine on a Monday, we want to be gone with all our vaccines by Friday. That's our goal. That's our commitment. So it just all depends on how much vaccine we receive.
Yeah, and if I could add on, Ryan, I think we have committed to really giving that vaccine out the week we receive it. So I think that's really important. It is, I would love to answer your question, I would love to be able to give everyone over 65, for example, availability this week, but we've had to stagger that based on the Ohio Department of Health recommendation and what we've heard from Governor DeWine. So ideally, we have more supply, but we know the reality of what's out there right now. We know that we continue to get, hopefully more supply every week. That's the hope. And then we will continue this as long as we need to continue it. But right now, the goal is on the age groups as identified, but really opening it up as quick as we can.
And where do school teachers fit into this? I know the state's laid out the age ranges, but where do teachers fall on that list?
I currently don't have the data on hand. I believe they're in the third week, February 1st. And we've been working with all of our superintendents for the duration of the pandemic, and they are providing at least a list to us of vaccine or individuals that want to receive the vaccine within the schools. So we'll have that list compiled here over the next couple of weeks, and then as soon as we receive vaccine, if we get the go-ahead, then we'll ensure that we work with the school systems to get it's K through 12 adults that work within the school system. So we'll ensure that we get them vaccinated as well. I don't know if Aaron, is yours the same? Mm-hmm. Aaron's the same.
Is there any other questions?
I do have one more quick question. Are there any concerns about the COVID variants and whether or not these vaccines will work on those?
Dr. Kravik?
Yep. Yeah, thank you for the question. I mean, what we know of the COVID variant right now, what we've seen, the one from Great Britain and also the one from South Africa, is that the spike protein on the surface of the virus is different than the original form of COVID-19. What we know so far is that the vaccine does have effectiveness, the same for the variant as it does for what we know is the normal COVID-19. And that's just based on how the body reacts to the virus itself, and it doesn't matter about the spike protein per se. So what we know is that the vaccine should be able to prevent, after the vaccination period, both the normal variant and then the new variants of COVID-19. So that's very encouraging. What it does, though, is it really does emphasize the fact that this variant has a much higher infectivity rate, a higher R naught number, R sub-zero number. And that number tells us that it spreads more easy than the normal COVID-19. And COVID-19 spreads more easy than normal common colds and the flu. So that makes the hand hygiene, the mask wearing, the social distancing, even that more important with the fact that we know the variants out there now because the spread is a lot more. So I think the timing is perfect for the vaccine now that we know this, the variant of the COVID-19 is here.
And just another quick question about the vaccine. When they make their appointment, if an 85-year-old calls, makes an appointment, should she have a family member or someone take her, or should she come by herself just because of that 15-minute time zone after she gets the vaccine? Like, what should they know about getting to their appointment?
Yeah, I think everyone's going to be different depending on their capabilities. Some of the questions that we ask is an emergency contact number in the event if something should happen. But anyone out there that has a family member, a friend who's 80 and older, if they need help either getting to their appointment and or staying here at the appointment, we encourage them to help them out. And we include that with getting them registered through the processes as well.
Got it. And just to be clear, other than I saw Giant Eagle, you call next Wednesday, but the other providers, you can call tomorrow at 8 a.m. The hotline and the website will go live tomorrow at 8 a.m.
Our website and our link is going to go live at 9 a.m. and then our call center from there on out will be open Monday through Friday from 8 until 4:30, and we ask you to call during those time frames. But our link will be live first thing tomorrow morning.
Thank you.
Sorry.
Southwoods Health's hotline is at 8 a.m. tomorrow. It will be Monday through Friday, 8 to 4, until we run out of vaccine.
Our website is already functioning, but our call line is 330-502-4276. And I just got a text from the woman that works it, and she said, "What just happened?" Because I just had 30 phone calls in the last 20 minutes. So already people are hearing what we're saying and calling that number. So thank you.
And if someone somehow they maybe don't have access to transportation to get to an appointment, but they want to get the vaccine, how would they go about that? Or maybe they don't have family members who can help them. Is there any answer for that?
I was just going to say right now, you know, if they could get to a bus line, our buses are free in the city of Youngstown. WRTA really has not had any, it's been free, I think, since last April, maybe. So you can use the bus line, or, you know, let us know at your call and we'll figure something out. I know people that are homebound will be able to help them. If, you know, if we have to go to their home to do it, we can. And that's, like I said, that's from the health department at Youngstown City.
And from a Mercy standpoint, our line goes live tomorrow morning as well, 8 a.m. The 866-624-0366, which is the way we schedule. Just to clarify too, I mentioned the mercy.com to print off your attestation, but we're asking you to schedule through the phone line of the 866-624-0366. And Aaron Bishop's point as far as the transportation, our location on St. Elizabeth Youngstown is on the bus line as well. So we want to encourage access, and really, if there's any issues as well, you know, you certainly reach out to us, and we'll certainly do our best to help with transport.
And just quickly, I know Dr. Kravik, you talked about whether you're not sure if it'll be Pfizer or Moderna, but does anyone else know if it will be Pfizer or Moderna? Does it matter if someone's curious which one? Do they have a choice? Do you guys know that?
Right. Let me answer the question about that, then I'll defer to the rest of you on what you have. But, you know, the Mercy is managing as a market, meaning we have received both, and we're going to need to work where the logistics are best between the Pfizer and the Moderna. It doesn't matter. The efficacy of both vaccines are near identical. What we know is possible side effects are near identical as well, and the outcomes seem to be near identical. So the difference is the follow-up. Pfizer's 21 days, Moderna's 28 days. So our teams are doing a very good job on all the healthcare teams of making sure that we follow those guidelines as far as getting the follow-up appointments scheduled and making sure that follow-up is done. That's very important to finish the series. But I do get that question a lot: is, you know, which one should I get? Can I pick? It's going to be very challenging because of this scarcity of the resources. But from a medical standpoint, it really doesn't matter. I'll defer to the rest of you to answer the rest of the question.
We're getting
Yeah.
We have a
Do you mind if I answer for all?
Yeah,
just do it for
Okay.
go for it.
Based off of the list that we received this week, all other providers in this room are receiving the Moderna vaccine.
And I think just one of the logistics, because the question gets asked, is the Pfizer is the vaccine that requires the very low temperature freezer. So Mercy purchased that at St. Elizabeth Youngstown campus several months ago in anticipation of that. So the Pfizer logistically is harder because of the sub-zero freezer. I think it's minus 90 degrees as far as the temperature. So that's logistically some of the problems that is out there with Pfizer. But that doesn't affect anything about the administration or the person receiving it at all.
Any further questions? Okay, we'll go ahead and wrap this up. Once again, I want to thank the news media for allowing us to have this press conference, and we know that you are a partner with us, ensuring that the information gets out to the community. I also want to thank our health partners once again for joining us here today. We will make this video available to all news outlets, and we will be sending out a press release with all the information that we discussed today. Thank you.